Hello, this is Jane Rooney from One Health Coordination at Veterinary Services. I'm here to talk to you today about the zoonotic disease and One Health portion of the umbrella cooperative agreements. I'll cover the One Health Coordination Office's roles and responsibilities, the zoonotic disease and One Health goals and objectives for surveillance, preparedness and response, and outreach and education, and also the way zoonotic disease and One Health funds will be allocated. The One Health Coordination Office is here to assist program managers and recipients as needed to develop the most effective state-specific work plans that accomplish the goals and objectives in support of our mutual zoonotic disease and One Health mission. You will see as I go through the goals and objectives and in the reporting section of the zoonotic and One Health guidance, we have made these more operationally focused and measurable. We'd like you to think of zoonotic disease and One Health issues as you would program diseases and FADs. For the surveillance goals, we want to identify opportunities for coordinating zoonotic disease surveillance activities across animal, human, environmental sectors and implement processes to improve information sharing between those sectors. We'd like you to provide routine and ad hoc information that allows state and federal partners to assess threats and effectively prevent, detect, prepare for, and respond to zoonotic diseases and One Health events with an animal component. For preparedness and response goals, we want to prevent, detect, and respond to zoonotic diseases and One Health issues as quickly as possible using a multi-sector One Health approach and strategies that protect animal agriculture, animal, and public health. We also want to identify and implement best practices for partnering and communicating with cross-sector officials and other One Health partners during zoonotic outbreaks and One Health events. Educational and outreach goals include identifying areas where increased zoonotic disease and One Health issue awareness is needed, and attending or providing or developing training and outreach activities or tools and materials to fill any gaps. We also give you examples of what that might look like in the guidance. Now we'll talk about the specific objectives. So under surveillance, again, I'd like to emphasize that we've made these much more operational and measurable, and we'd like you to develop and maintain cross-sector communication protocols between human and animal health officials regarding human cases of zoonotic disease and confirmed or suspect cases of zoonotic disease in livestock and poultry. We'd also like development of cross-sector surveillance and risk assessment plans for zoonotic diseases and One Health events specific for your state. That includes state-level cross-sector planning for monitoring human illness during known or potential zoonotic disease outbreaks. We also talk about conducting routine and/or event-specific cross-sector surveillance and risk assessment for zoonotic diseases and other One Health events. Also, enhancing cross-sector information sharing by identifying and implementing methods that facilitate communication and reporting between One Health partners. For preparedness and response objectives, again, much more operational and measurable. We look at development and maintenance and exercising of cross-sector state-level plans to prepare for and respond to zoonotic diseases and One Health events that fully engage public health and environmental health sectors. Investigate, control, and eliminate, if that's possible, zoonotic disease or outbreaks of One Health issues in collaboration with local One Health partners. Develop and conduct targeted epidemiologic studies or assessments of zoonotic diseases or One Health issues specific in your state in collaboration with One Health partners to identify risk factors and opportunities to protect animal and public health. We also like you to implement cross-sector risk-based management plans to mitigate risks associated with zoonotic diseases and One Health issues. Now for education and outreach objectives. Attendance or providing at least one cross-sector zoonotic disease or One Health training or meeting workshop to enhance understanding of zoonotic disease prevention, investigation and response, and also practical tools for facilitation, engagement, communication, and problem solving among professionals from different sectors and/or disciplines. The development or provision of cross-sector educational outreach materials that enhance understanding of at least one zoonotic disease or issue of concern, and engaging One Health partners as appropriate in that development. Also, the development of One Health partnerships within the state using methods to promote additional communication and collaboration. And examples include tabletop exercises, after-action reviews, and action planning workshops. You also want to try and identify any needs or gaps and develop communication and response plans that fill those. And we've also talked about other activities that are linked back to surveillance and preparedness and response sections that we spoke about earlier. So for allocation of funds, allocation of zoonotic disease funds should be a negotiation in relation to the work plan activities that fulfill the zoonotic disease and One Health goals and objectives. This means right-sizing the allocation or the allocated budget amount to reflect the quality and the measurability of work plan activities in accomplishing the zoonotic disease and One Health mission. Again, I'll be available to help program managers and cooperators as needed with specific questions related to the zoonotic disease and One Health section of the Umbrella Cooperative Agreements. Thank you.